Because Australians over 16 have been vaccinated in such high numbers, the coronavirus has found its way into younger and younger age groups. In Victoria, the highest proportion of cases is now in the 0 to 9 age group. It's a similar story in New South Wales. Last month, between 22 and 26% of COVID cases were in children under 11.
The proportion of cases in younger age groups has increased, but we've been very lucky just in the last few weeks that we haven't seen a surge in cases that was perhaps anticipated when children went back to school.
Even without that surge, today there were still at least 29 schools shut across New South Wales and Victoria due to COVID cases.
Children have very mild effects from COVID, and we can vaccinate them, we should be vaccinating them, and to be testing and shutting down schools because children have COVID just seems to be, just adding more pain.
So lockdown may be over, but keeping kids at home isn't. While the vast majority of children who test positive won't get sick and end up in ICU, if the numbers increase substantially, there will be some children who'll become quite unwell.
The Tennessee Department of Health reported more than 7,500 cases in school-age kids.
That's what happened in the southern US state of Tennessee over the northern summer. When we last spoke to pediatric infectious disease specialist Dr. Ritu Banerjee in August, her hospital had just experienced its second childhood death due to COVID, a statistically rare event.
In our children's hospital, we had, at the peak of the Delta surge, overflowed our pediatric ICU. We had to find extra bed space in other parts of the hospital to house all the COVID positive children who were hospitalized.
While that surge has now passed, doctors in the United States are still worried about COVID in children. Dr. Banerjee believes the recent emergency approval of a low-dose Pfizer vaccine for 5 to 11-year-olds will significantly reduce the risks.
This is a vaccine-preventable disease in children as well. And so every child who gets infected or hospitalized or has an ICU stay or God forbid, dies, that's a vaccine-preventable tragedy.
We're in a very different situation to the USA, where they're introducing vaccine in this age group as an emergency measure. And the reason it's so different in the United States is that they have such low rates of vaccination in adults. In Australia, we're very different. We've got very high rates of adult vaccination, and we're approaching summer, and so we can afford to wait.
Last week, Professor Nigel Curtis published a paper with colleagues overseas arguing we should proceed with caution when it comes to vaccinating young kids.
I think it's highly likely that ATAGI will end up deciding to use this vaccine in this age group. But I think with coronavirus and this pandemic, we've really learned to expect the unexpected.
The main vaccine side effect of concern is inflammation of the heart, known as myocarditis. This has occurred in a small number of young men, mostly over the age of 17. The relatively small vaccine trial among 5 to 11-year-olds in the US did not detect any myocarditis. But even if it occurs at the same rate as young men, there are much greater risks of myocarditis in children who contract COVID itself and who later develop a rare multi-system inflammatory syndrome.
So many times families don't even know their child had been infected previously with COVID. But many of these children who develop MISC do develop myocarditis or dysfunction of the heart's ability to actually pump blood. And so that leads sometimes to them requiring ICU hospitalization.
Professor Emma McBride is an epidemiologist and infectious disease modeler at James Cook University and has looked at the potential benefits of vaccinating young children.
We could, even with the Delta strain and the current vaccines, get very close to herd protection if we lower the age of vaccination to 5+. And that would achieve effectively very close to herd immunity in Australia.
Because the risk of the actual disease in children is so much lower, the safety bar for a vaccine in this age group has to be much higher. We need to be cautious because it may be that their immune response to the vaccine is different. We're simply saying to take the same approach as we have done with every other vaccine and look at the data and make sure the benefits outweigh the risks.
Today's announcement that the kids' vaccine won't be available till the new year will allow us to learn from the US experience so that when the time comes, parents can be sure they're making the right decision.
The data show that the vaccine is very effective and very safe in the 5 to 11-year-olds and very comparable to the efficacy that was seen in 12 years and older. If you can reduce the number of people who are actually infected and contagious, you can reduce spread and you can end this pandemic. And then you can get back to normal life.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.